If your feet burn, the first question probably shouldn't be which supplement should I take for neuropathy? The first question is this actually neuropathy? Because burning feet is a symptom. It's not a diagnosis. And depending on the pattern, burning can come from very different problems. It could be a generalized peripheral neuropathy. It could involve small nerve fibers. It could be a compressed nerve in the ankle or foot. It could be coming from the spine. And sometimes it may not be primarily a nerve problem at all. Dr. Michael Fitzmaurice, a peripheral nerve surgeon, across more than 3,000 procedures I performed, one of the most important parts of evaluating nerve symptoms was figuring out where the problem was actually coming from. And with burning feet, there are a few clues that can help narrow that down. The first one is simple. Is it both feet or just one? If the burning is in both feet, especially if it started in the toes and gradually moved upward, the pattern is more consistent with a generalized peripheral neuropathy. Diabetes is one of the most common causes. Prediabetes and glucose dysregulation may also be associated with nerve problems, although the research is more variable depending on how neuropathy is measured. Small fiber neuropathy can also cause this type of burning pattern. These smaller nerve fibers help carry pain and temperature signals. So people may describe burning, pins and needles, painful sensitivity, or abnormal hot and cold sensations. And as I explained in my previous video, small fiber neuropathy can sometimes be present even when a standard EMG or nerve conduction study is normal. But bilateral burning doesn't automatically mean diabetes. Nutritional issues can also matter. Vitamin B12 deficiency is a well-established cause of neuropathy. But there's another one that surprises a lot of people, and that's vitamin B6. Because B6 is commonly included in supplements marketed for nerve health. However, too much B6 can actually cause a sensory neuropathy. That means something a person is taking because they think it may help their nerves, in some cases may contribute to the same burning, tingling, or numbness they're trying to treat. There isn't one simple dose where I'd say everyone below it is safe and everyone above it is toxic. Individual susceptibility appears to vary. So the important thing is to look at your total intake across supplements rather than just assuming more B vitamins are always better. Now let's say the burning is mainly in one foot. That changes the picture. One possibility is a focal nerve compression. A good example of this is tarsal tunnel syndrome. The tibial nerve travels through a relatively confined area near the inside of the ankle. Now, if that nerve becomes compressed or irritated, it can cause burning, tingling, or numbness into the bottom of the foot and toes. And the pattern can be very different from generalized neuropathy. It may be more noticeable on one side. It may follow the distribution of a particular nerve. And it can sometimes get worse with standing or walking and improve with rest. That's one of the reasons I pay so much attention to the location and behavior of symptoms. If somebody has symmetric burning in both feet that's slowly moved upward over time, that tells you something. If somebody has burning in one plantar foot that gets worse when they stand or walk, that tells you something different. Neither pattern makes the diagnosis by itself, but it helps determine where you should look next. Then there's the spine. A lumbar nerve root problem can also produce burning, numbness, tingling, or pain into the leg and foot. This is usually a different pattern from a classic length-dependent neuropathy. It may affect one side more than the other. It may follow a particular nerve root distribution, and there may be back pain, sciatica, or weakness in a specific muscle group. So if somebody says, my foot burns, that symptom by itself doesn't tell you whether the problem's in the foot, the peripheral nerve, or closer to the spine. You have to localize it. There's another group of causes that I think is important because they can be mistaken for neuropathy, and that's vascular problems. Peripheral arterial disease can cause pain or burning in the feet, particularly when blood flow becomes significantly impaired. And the pattern can give you clues. Advanced vascular pain may be worse at night when the leg is elevated or when someone's trying to lie flat. Some people actually feel better when they hang the foot over the side of the bed or stand up because gravity helps improve blood flow to the foot. Now that's almost completely opposite of what you may see with some patients with nerve compression problems, where rest or elevation can improve the symptoms. And if burning is associated with a cool foot, reduced pulses, skin color changes, non-healing wounds, or ulcers, that deserves vascular evaluation rather than assuming everything is neuropathy. Another less common condition is called erythromyalgia. This typically causes episodes of intense burning along with visible redness and increased warmth of the feet. Heat and exercise may trigger it, and cooling may relieve it. That combination of burning plus obvious redness and warmth is very different from the typical appearance of many peripheral neuropathies. And then there are other medical causes that may need to be considered depending on the person. Chemotherapy can cause peripheral neuropathy. Chronic alcohol exposure can contribute to neuropathy. Kidney disease can cause a distal neuropathy. Thyroid disease, autoimmune disorders, certain medications, and other systemic conditions can also be a part of this differential. The point is, not everybody with burning feet needs to be tested for every disease on that list. The point is that burning feet is not specific enough to tell you the cause. So if you're trying to make sense of burning feet, I'd start with 3 questions. First, is it both feet or one? Symmetrical symptoms in both feet raises generalized metabolic, nutritional, toxic, or small fiber processes higher on the list. A one-sided or highly asymmetric pattern makes me think more about localization, such as a focal nerve problem or a nerve root problem. Second, what makes it better or worse? Does standing or walking make it worse? Does rest improve it? Does the position of your leg change the symptoms? Is it mainly worse at night? Those details certainly matter. And third, is anything else happening besides burning? Are you developing weakness? Are you losing your balance? Is there swelling? Is the foot changing color? Do you have any wounds that aren't healing? Are the symptoms progressing quickly? Those findings can completely change how urgently the problem needs to be evaluated. There are also a few symptoms I would not sit on. New bowel or bladder dysfunction, numbness in the saddle area, rapidly progressive weakness, a major sudden change in walking, or severe pain associated with major color changes, ulcers, or signs of poor circulation. Those are situations where prompt or urgent medical evaluation may be appropriate. So if your feet burn, don't automatically assume that you have one specific type of neuropathy. And don't automatically assume that the answer is another supplement. You need to look at the pattern. Is it both feet or one? What makes it better or worse? And what other symptoms are occurring with it? Those 3 questions can tell you a lot about what needs to be investigated next. If you're dealing with burning, tingling, numbness, or other nerve symptoms, and you're trying to organize some of the factors that may be contributing, I have a free 5-minute nerve health assessment. I put the link in this video.